Hi, everybody. We are going to talk about, as we get ready to start venipuncture, we need to talk about lab procedures first. There's two kinds of labs that you guys will do as a medical assistant. Some are CLIA wave labs, and we're going to talk about that today. And then we're going to talk about, we'll talk about reference labs. That is labs that you will collect, and then we'll go out to places like LabCorp, Quest, DRL labs. They'll go out to one of those types of places. And those are things that you can't do in-house. So we're going to, before we kind of get rolling on this presentation, I want to give you a little bit of information. You will have a reading assignment related to this. So, and I will post that for you. So I want to talk to you a little bit about CLIA wave testing and just kind of give you a definition of what CLIA wave testing is. The Food and Drug Administration requires that all testing meets specific federal guidelines, whether that's reference lab testing or hospital lab testing or CLIA wave testing. And it determines the complexity of the test and whether or not, how complex that test is going to determine whether or not it can be done in an ambulatory setting, like in a doctor's office or in that kind of setting, or whether it needs to go to a clinical laboratory, whether it needs to go to a reference lab. Ambulatory care centers, which would be like a doctor's office or outpatient clinic, typically can perform, and I want you to know what CLIA is. That will be important for you to know what that CLIA is. So I'm fixing to tell you what that is. Clinical Laboratories Improvement Amendments. CLIA means Clinical Laboratories Improvement Amendments. That's what CLIA means. CLIA wave testing. And that's a simple laboratory test or procedure that the FDA feels like can be done by in a doctor's office using a predetermined equipment. So the FDA says, okay, you can do CLIA wave testing with this specific equipment in an ambulatory setting, which would be your doctor's office. And they may be performed by medical assistants once they're trained to do it. And lots of times these are performed daily. Especially this time of the year, we're doing lots of, in the clinical setting, they're doing lots of rapid flus and rapid streps. And those are done, and monospot testing, those are CLIA wave tests, and urinalysis, those are CLIA wave tests that are done very frequently every day. UAs are done all the time, urine dipsticks. So first thing we're going to do is we're going to talk about good lab practices related to wave testing. And so when we talk about CLIA waived, you will want to ask if your facility has a CLIA waived designation. And so with a CLIA wave designation, that means that the Department of Health and Human Services has come in and said it was okay for those specific labs to be done in your location. So good lab practices with wave systems are very important. That means following the directions, making sure you're doing the controls like you're supposed to, and just following good protocol. Whatever the testing material tells you to do, you're doing that appropriately so that you're getting accurate information. So what is wave testing? Under CLIA testing, those are they're categorized by complexity. So like I said, waived tests are usually simple lab examinations or procedures. They're cleared by the FDA for home or ambulatory use. There's a very narrow margin of error in those if they're done according to the directions, and there's no risk to the patient. If they're performed incorrectly, there's no immediate risk to the patient. So those are the things that help the FDA determine whether or not something is CLIA waived or can be a waived test. A waived test must not be if it's done incorrectly, it must not be harmful to the patient. There has to be a narrow margin of error for false results, the FDA has to say it's okay for it to be done, and it has to be a fairly simple procedure. And you're going to see as we talk about these CLIA Waived tests that they're pretty simple. You're going to have a list of them that are they call them point of care testing. That they're very fairly simple to do, and there's a very narrow window of there's a very narrow margin of having inaccurate testing. So what does that mean? What does waived means? Waived, for the most part, it means that there are higher complexities of testing done, but it's usually done in a routine. Waived tests are usually done in sites sites that are not routinely site inspections are not routinely done. So in a doctor's office, they're not going to come and monitor that location.
Ms. Falls, please call 3910. Ms. Falls, please call 3910.
Sorry, guys, they're not going to come in every 18 months to inspect your lab. They're going to come in every 3 to 5 years or even longer sometime. Proficiency testing is not required, so there is not every 10 tests there doesn't need to be a control done. And then also the qualifications for the personnel. It just basically means anyone can be trained to do these tests. Where in a reference lab, those people have specific training. Most of them have some kind of certification and or degree in a hospital lab setting or in a reference lab. And there's very, very strenuous requirements in those reference labs in a hospital lab. Whenever a test is in a waived setting, the Department of Health and Human Services or Department of Aging and Disability or the Department of Health, whoever does the review for that doctor's office, they may not come but once every 5 years. So there's much less strenuous monitor of CLIA waived testing. Basically, you get a waived designation, and then they come in. And when they do the evaluation for the entire clinic, they do just to see what you're doing there with that. Oops. And I'm going to have to, as you can tell when I was typing, I didn't do such a great job there. Sorry about that, guys. Okay. So what do the state regulations say about waived testing? Each state has, there is a list from the from the Center for Disease Control. There's a complete list, and we'll look at that shortly, or in a little while, we will look at the complete list of waived tests. Now, each state can say certain tests are or are not available to be waived, and that's usually based on the Department of Health. The Texas Department of Health usually determines what tests can be done in each state. Also, you have to get a CLIA waived designation from the state to be a testing site. You have to apply for that. You have to send in specific information. Usually the Department of Health comes out and checks to make sure you understand about keeping logs and about reportable tests that must be reported, how often they must be reported if it's a communicable disease. But just make sure you have your policies and procedures in place, and also that you understand how to follow the manufacturer's instructions for the testing material that you have. So they're going to come out that initial time before they designate your particular location as a CLIA waived testing site. They're going to come out and make sure that you have some policies and procedures in place and that you meet the requirements for state licensing. Wave tests are simple, but Yes, they're fairly simple to do. Anyone can learn them, but there's some things we have to think about. Any test, if it's not done appropriately, can give false results. It can give a false positive or a false negative. An example, right now they are doing lots and lots and lots of rapid flu screening. So it tests for flu A and B, and what they do, and many of you may have had this done, but they have a specific swab that they have to stick way back in your nose and wiggle it around, and then they have to there's some specific procedures that we'll talk about that must be done after that. It has to be put into a solution and kind of swirled around and then let sit for a minute. And then you put a specific testing strip, take the swab out, put a specific testing strip in there, set a timer, and then the testing strip will determine whether it's positive or negative. But say I didn't get back far enough to get mucus on that swab. Maybe I just went on the inside of the nose. That could give a false negative when someone does have the flu. Say I didn't roll it around in the solution long enough. I didn't let my test strip sit long enough. All of those things could give false results. So we want to make sure that that we're doing it appropriately. Okay, guys, sorry I had to pause there for a minute. I had a phone call. So let's get back to our Waived testing. So like I said, Waived tests are simple, but once again, we have to be really careful about how making sure that we follow the directions correctly. Tests worth running should be associated to good lab practices. We need to be sure we're using gloves, we're using appropriate timers, we are in a designated area that is just specifically for those testing. We want to make sure that we can separate specimens so that there's not accidental mix-up. So what are good lab practices and what are good management practices? We're going to talk about those things. One of the things that's part of a good lab practice is to have the current product insert. So every time you get a new box of supplies, normally your tests are going to come in bulk boxes for testing. You're going to have either things like 20 flu swabs with the amount of testing reagent and materials to run 20 rapid flus or 25 rapid streps. You're going to buy a bulk package of fecal occult stools. You're going to have all of those things available to you. So you want to make sure every time you get a new box, you just be sure that you look through the product insert to make sure nothing has changed from the last time. So for some tests, there are defined regulations that are waived, like fecal occult blood. It has a very specific, and that has not changed in many years. Now, the way that it's ran, sometimes we run them in-house. Sometimes we'll give patients a set of cards to take home, and then they'll ship those off. But if we're running that in-house, then there's been a standard way to do that for many years. Some have they're only certain specific test systems. So like all fecal occult blood are waived, only certain rapid streps are waived. And so the strep antigen is waived, but other cultures and things that have to grow, then those are not particularly, those are not waived. So you have to make sure that what you're ordering for your company or for your physician's office, because it may fall to you as the clinical medical assistant to be the person who's ordering products for your CLIA waived, you have to make sure that what you have is a waived test. And then some kits may be waived for moderate complexity depending on how the specimen is used, like a monospot test. That is, it takes a little more work for that because it is a whole blood waived, but it only uses part of the material of the blood. So be sure that whenever you know that what you're ordering or what you're using, either the kit or the system that you've ordered, make sure that it says when you're looking at the products to order that it says CDC CLIA waived. You want to make sure what you got. That's the first thing to making sure that you're doing everything appropriately and that you have good management, is that what you've ordered is appropriate for what you're supposed to be doing. The last thing you want to do is to spend money and then it not be something you can actually use, because once you get those things and open up the product to look at it, open the box, you can't send it back. So be sure what you get is what you've ordered. The things you're going to look at on that product insert is you're going to look at the intended use. Is it intended to be used at a reference lab, or is it intended to be used in a ambulatory setting? How do you store it? Some things have to be refrigerated. Some things have to be protected from light. Some things have to be protected from moisture. So you want to be sure that it is stored appropriately. Precautions and warnings. Be sure that you look at that. Be sure that if the reagent has to be refrigerated once it's opened, you put that in a refrigerated setting. If it says it must be protected from light, make sure that you put it in a bag, some kind of dark colored Ziploc bag. Be sure you follow that. Patient preparation. You want to be sure, like with a fecal occult blood, that you tell them no anti-inflammatories for a week, no vitamin C. There's some specific things that you have to tell them prior to. If you're going to do a PTINR, which is a finger stick PTINR, a proton, you want to make sure they didn't take their medication that morning. You want to make sure that they're taking it later in the day after they have their testing, because it'll give a false reading. Make sure that you're collecting the specimen appropriately, like we talked about that flu swab. Make sure that you're going up the nose far enough to get mucus on that test swab. If you're doing a rapid strep, make sure you use a tongue depressor to push the tongue down, and you're getting all the way in the back of the throat, and you're swabbing around and getting both tonsils in the back of the throat. Then you want to make sure you understand how to follow the procedure and if there's any kind of procedural notes. So say that the procedural notes state that if you leave something in past the time limit, it can give you a false reading. That on a pregnancy test, if you don't see that control line, it's not, you need to dispose of that and start over. Make sure you understand how the test works. Quality control. So sometimes you're going to be using machines to run some of these testing. Sometimes you'll have a urinalysis machine that's CLIA waived as opposed to the dipstick. You have to run quality control on those every so often. Finger stick blood sugar. There's specific quality control that you have to document how often you've done the controls on that. So be sure that you're keeping those records. It'll tell you how to interpret the results. 1 line means negative, 2 lines means positive. 3 lines may mean positive. 2 lines may be positive for one thing, and it may have your control line, and one may be flu A and one may be flu B, and then they could have both and have flu A and flu B. What are the limitations of the result? At what point do you what point do you send that out to a reference lab for being unsure? And what would be the expected results? Should it be positive? Should it be negative? Or what happens if it has information that you are unfamiliar with, or it comes up odd compared to what it tells you? So know what the expected results should be. Also, okay, and we're going to give some examples. In the following, we're just going to talk about some examples from actual product inserts to show the kind of information you'll find in various sections of the product insert. It's important that you know kind of what you're looking for. So describe what is actually being measured. So the product insert is going to tell you that it's going to be measuring the percentage of concentration of hemoglobin A1C in the blood. So a hemoglobin A1C tests the average blood sugar average over about a 60 to 90 day period. So it's telling you, the first thing it's telling you is what it's tested. Qualitative versus quantitative. Qualitative will tell you that it's group A strep antigen directly from the swab. Qualitative detection. So quantitative is a number, qualitative is amount. So a rapid strep is going to tell you that it is going to be positive for group A strep antigen directly from the throat swab. The type of specimen. Not recommended for use with gastric specimens. So on a fecal occult blood, you're not going to look for occult gastric specimens with that. You're only going to use specimens from stool, not from gastric, from emesis, from vomit. So those are specific things related to intended use. Product storage must be kept at 2 to 8 degrees Celsius. Keep for 3 months. It can be kept at 3 months for room temperature. Cassettes must be stored in sealed foil packages or foil pouches. So once you open that foil pouch, if you don't use it, you have to dispose of it. Store out of sunlight. Strips must be kept in the bottle with the cap tightly closed. Those are very common product storage informations. They can be anything from hemoglobin A1C to certain types of reagents to urine dipsticks. So be sure that you're familiar with how to look for what product storage is needed. Precautions and warnings. Kits, reagents, and testing devices, how to handle them. Don't use past the expiration date. That's a really good thing for testing strips. Or any kind of testing product. Once something has reached the expiration date on anything in the facility, you're going to need to get rid of that. Don't mix components of different lots and kits. So maybe you still have some reagent from a flu kit, and you have some more, and you're just going to do swabs. That's not how that works. That reagent is only valid with that particular kit. You want to dispose of them once the kit's empty, even if you have a few drops left. Should not be interpreted by individuals with blue color deficiency or color blindness. So sometimes a pregnancy test may show up a blue line or two blue lines, or so if you can't see blue, you can't really interpret that particular testing. And do not interchange caps on reagent, because reagents, even though they'll have one might be red and one might be black, you don't want to put them on the alternate one because it may not fit appropriately or someone may mistake them. So be sure that you put the caps back on from the reagent that you find. So that's some good examples of precautions and warnings. Patient preparation. Finger stick cholesterol. You want to be sure that they do not eat after midnight, and because it will alter the accuracy of the results. Occult blood for 7 days. Avoid anti-inflammatories for 3 days. Avoid vitamin C in excess of 250 milligrams a day, and avoid red meats and red dye as well. So those are things for preparation that you would tell that patient. Be sure that you avoid these things, or be sure that you do these things. Specimen collection. Is it a finger stick or a venipuncture? It can be stored, the specimen can be stored for 4 hours to 3 days in the refrigerator. Do not use swabs that have cotton tips wood or wooden applicators. So sometimes they have to have a poly tip, or sometimes they have to have a metal applicator. Those are pretty common, especially with your flu swabs. Acceptable anticoagulants. Like it has heparin or fluoride, those kind of things. You have to be sure that may be something that's important related to the handling or the collection. Testing procedures. Follow exactly. Do not modify. Adhere to timing. So if there's a specific time that you're supposed to leave it in the reagent to use it to determine the testing, if you wait 5 more minutes, you're going to get false results. Don't modify. Don't use less or more of a reagent. Be sure that you swab and you do exactly how it tells you. Don't swab something and leave it sitting on the counter for 10 minutes before you run it. You got to run it exactly like it says. Procedural notes. And don't open the foil pouches until you're ready to test. Avoid cross-contamination. Read the results in 20 minutes. So those are all things you have to be aware of. Directions must be followed exactly for an accurate timing is essential. If you leave it in too long or too short, your results aren't going to be correct. Allow specimen to sit in test device to warm up it to room. Allow specimen and test device to warm to room temperature before they're used. Proton machines. A lot of times you have to keep the cassettes to collect a finger stick proton in the refrigerator. Those may need to sit out and warm up, or the machine may need to warm it before you put the blood on it. So be sure you're aware of those kind of notes. Quality control. This is very important for you to keep documented. Types of control to be tested vary with a specific test system. Sometimes they're external, sometimes they're internal, and sometimes there is an electronic testing. Test control, you have to do the test according to whatever the manufacturer's instructions are. Be sure you read the entire section carefully, and you don't want to miss anything, because when you do come in and get audited, if you haven't kept your documentation and done what you're supposed to, they can take away your ability to run testing, certain tests in your facility. That's very inconvenient for your patients, and it can be very costly for your clinic. Assure that you get the exact results from the control system. So when you're running your controls, most places do that first thing in the morning before they actually open. They'll try to do all their controls that they can and get those documented, so they're done and behind them, as opposed to waiting until if you need to run your UA control. You don't want to do that while you're collecting a specimen and it just sits there. You want to make sure you're doing it and you're documenting it exactly like you're supposed to. External controls, that could be a reference solution or materials like swabs. Maybe you have test solutions that go on to strips for a finger stick blood sugar machine, or maybe you have specific urine strips that need to go into the machine to determine it. And it can be included in a kit, or it may need to be purchased separately. And if you run out, then you're going to have to repurchase those. Compare your control results with the expected ranges, and then either print the values if you can print them. Otherwise, be sure you're documenting them regularly. And when you do them, the time, the date, and what the results are. Internal, those are built in. A lot of proton machines have built-in controls. A lot of the other automated systems have an internal control, and it does it ever so often. It's a built-in test reagent device to ensure that reagents are active and that the samples are added correctly and the tests are performed according to specific controls. It's very common with qualitative, not so much quantitative, but qualitative, like strep, pregnancy, H. pylori, and monospot. Lots of times they have built-in controls along with your PTINR. Be sure that whatever's going on, the procedural control typically includes appearance with a colored dot, a line, a bar. It'll have a specific way to document that, and then generally you can print that out of the machine. Electronic controls are insertable, reusable devices. It'll be specific cassettes or cartridges or test strips that are specific quality control measures. They're used for specific. They're supposed to be used at specific times for specific amounts, and those are common with your hemoglobin, H&H, your cholesterol, your A1C, and your proton machines. And they compare control results with what is an expected value. So you may have a high and a low concentration solution. You may just have a cassette that it just says it's your control and it run it. Sometimes it just runs it, like I said, may run itself, and then you print those values or document those values. Results and interpretation: positive, negative, whether it's valid or invalid, whether it's within a normal range. Maybe it's too high or too low to be read. It may tell you to retest because it's invalid. So it's going to give you some specific results, and you're going to follow those directions. Limitations of the procedure. So this would be something on that product's package that would tell you cause of false positive, causes of false negatives. It can tell you they must have a certain range for it to be valid. They must have a hemoglobin between 7 and 24. If it's lower than 7 or above 24, it's not going to give you results. It's going to give you an error. So be sure that you're aware of that. Finger stick blood sugars, if it's going to be over 500, lots of times it's just going to say high. So be aware that if it reads an alternative or it doesn't give you a number, then that you're going to need to retest and then report that to the physician immediately. Expected value. So it's going to tell you what normal would be and what to expect. You're going to look at those things very specifically. We'll detect HCG, which is pregnancy hormone, at 20 milliliters, at 20 milli units per milliliter. It will detect INR up to 12 seconds. Proton values between 10 and 13. It's just going to give you their normal ranges. So be sure you're aware of the normal ranges. That's why we talk some about what normal ranges for different results are. So other good laboratory practice, being sure that you're using your test controls based on what the manufacturer tells you. Positive and negative controls should be tested with each new lot or shipment. So every time you open a new box, you need to do your testing. Or that you may have daily requirements. You may have some require controls with each specific testing. So be sure that you check the calibration daily using your cuvette, or you do it. You do positive and negative controls when you open a new kit, or whenever it's a new day. Whatever the normal manufacturer requirements are, be sure that you're doing those and documenting them. That's the big thing. Not just do it and say you did it, but documenting it. And if you're able to print out the controls, print that out, and so you have that documentation as well. At minimum, test external controls with each new lot or kit, reagents, and testing devices to detect problems during shipment. Maybe it got too cold, maybe it got too hot, maybe it got jarred around too much, maybe it cracked a cassette to the point where you can't really see it, but the machine can tell. You want to look for built-in procedural controls with for each test patient on some, and make sure that the machine itself did a test. There's proton machines that I used as a nurse that it did a control for every patient, and it would show you that the control was completed and that it was finished. And when you printed out their results, it would actually print out those controls. Also, be sure that you're doing whatever the manufacturer says. Always be sure that you follow manufacturer instructions, not just on quality control, but on all procedure related to your labs. Correlate test results with the patient presentation history and diagnosis. If a patient doesn't have a history of taking anticoagulants and their results are really high, you may want to retest that and then report that to the doctor. Be sure that you compare them with, and then you may need to, if it's really high, you may need to go ahead and draw blood and send it to a reference lab. If you do a rapid strep on someone and it's positive, but they still have signs and symptoms, you may do a throat culture and send that on. So be sure that you are making sure that the results are matching with how your patient presents. And if not, talk to the doctor about it and see what else they want to do. Training, there are always quick reference training cards to remind you how to do your testing. That's great. But you also want to make sure that that you as a new employee not only read it, but you have someone train you on it and that you're checked off on it. And then if you have to train someone, be sure that you make sure that they're competent, that they can do that, they can do the testing. Make sure someone's checking you guys off regularly. That should be part of your yearly evaluations, to make sure that you're doing these things correctly so that you're not getting sloppy. So training is important. And if you don't know how to do something, ask. Don't just assume you can do it by reading the directions. If it's still confusing, ask how to do it. Find someone to show you. Once again, keep those logs. Make sure that you document new boxes, new reagents, new testing device, all your quality control results, and your patient results. It is a federal requirement for you to keep the results for flu because they have to be reported every 7 days. So someone has to be reporting to the CDC every 7 days all positive flu results, whether you're having more or less than the week before. So be sure there are monospots you have to report. There are specific tests and things that you may do as a CLIA waive that must be reported to the Department of Health or to the Center for Disease Control, depending on what it is. So you just have to be sure that you're keeping test results, a log of the test results, a log of your quality control, and then documentation when you change boxes or you change kits or you open a new box of cassettes or testing devices. Be sure that you document that in the control log. And then if you have problems, this is a really an important thing. If you get a box of testing material that has a bunch of false positives, or you have several false positives, or they don't match up to what's going on, you want to report it to the manufacturer, and then you want to report it to MedWatch. Most manufacturers will replace that and give you an opportunity to get a new box for free. They just you send that back, they send you a new one, and they replace it. But you want to be sure you're reporting anytime there's damage or issues. All right, well, that's it for CLIA Waive. You're going to have some reading material related to labs, and then we will talk more about labs, a little more about labs a little bit later when we talk about venipuncture. So be sure you read your material and that you're familiar with this material as well, because you will have a quiz and then a test later on it. All right, you guys, thanks so much. Have a wonderful day.